All right, so I'm going to give you an example of a patient of mine who came with a failed back surgery. And what that means is he had surgery, but he was not happy. He's not happy because his expectations were not met. He couldn't lift, he couldn't go on a hike, he couldn't even go to school in a comfortable position, sitting there in the classroom for more than 2 hours at a time. So I'm going to show you how we can avoid this from the get-go, why this developed, and how we prevent this from happening again. So looking at his x-rays, this is looking at the tailbone, right? This is the lower back. There's typically 5 bones in our back. We're looking at the spacing between those bones. If you look at this x-ray, you wouldn't find it to be what we see abnormal, right? There's nothing here that's going to jump out at you when you look at this x-ray, right? The only thing I can say is that there's some narrowing of that disc at the very bottom, this cushion that sits here between these two bones, which can explain why he has this chronic back pain. And even though they did a surgery where they did a microdiscectomy, which when they go and shave away that piece of disc that's pushing on the nerve, he's still left with the back pain. So the MRI then shows that this disc is darkened. It's like almost like a tire that's worn out and has lost its air pressure. And you can see they did the surgery, they opened up the space for the nerve, but the disc problem is still there, right? So this is a very common scenario that I see where they had the surgery, everything was done perfectly, but the patient's expectations were not met because guess what? The functionality, their pain level, things that they want to do is, especially for a young active guy or woman, they can't do, right? And so the way we can avoid this from happening is oftentimes in the right setting when the person's main issue is back pain over the leg issue, the nerve issues, is we do a disc replacement surgery. And that's actually replacing the disc. It's like replacing the tire in your car and getting you a brand new tire so that you can be physical, you can be functional, you can be active. And he's one of my happiest patients. He's back to school. He came to visit me from Pennsylvania, and he couldn't be more thrilled because, again, we were able to meet his expectations and make sure that he understands what it is that we're trying to achieve by taking the time and getting to know the patient and their goals. So, a very common question is, well, what's the recovery like? What are the expectations of recovery? That's a huge part of it, right? We have to set you up for success by oftentimes doing some pre-rehab work with the physical therapist, but afterwards, starting at the 2-week mark, I have my patients rehab, get their core strong, get the hip flexion, mobility back on check so that we can actually regain total function. It takes about 6 weeks until then they can hit the gym, and 3 months for full recovery. Like things like think of things like skiing is when they can actually do that. Believe it or not, even with a new disc replacement surgery. So if this sounds like you, don't settle for the first opinion. Seek help. There's a lot of options. There's a lot of innovative ways to not only provide the right alignment and get improvement, but how to do it safely, how to do it in a way that's going to give you the full functionality back.